Hello student nurses, in this video we will be learning how to answer NCLEX style questions using Kaplan decision tree. This will not only help you when you take your NCLEX, but with all your nursing school exams. If your program formats tests like the NCLEX, some schools do and some schools don't. So the Kaplan decision tree is made up of basically 5 different steps. And it's based on the process of elimination. So this is the decision tree right here. So the very first thing is, what is the topic of the question? What is it talking about? This will help you guide your answer. The next step is, are the answers assessment or implementation? Then the next step would be going through the Maslow's hierarchy of needs, basically. So you want to decide, is it physical or psychosocial on what you'll be performing or helping the patient with. Okay, then next, do any of the answers have to do with our ABCs, our airway, breathing, and circulation? And after that, what are the outcomes of other answers? So the outcomes of the other answers will obviously be not as good as the right answer. And something to keep in mind when you're answering something that's not select all apply is, what would you do if you could only do one thing before you left the room? Okay, so let's go to an example question. So this question is, the nurse enters the room of a patient who is experiencing shortness of breath. What action should the nurse perform first? Okay, so let's break down the question first and find the topic. So the nurse enters the room of a patient. Okay, that's just the fluff telling us everything. What the nurse is currently doing, we need just ignore that. So the patient is experiencing shortness of breath. So I would say shortness of breath is the topic. Okay, and then what action should the nurse perform? It's a good thing to keep in mind that action doesn't always mean implementation. It might mean assessment. But anyways, let's go on to these 4 options down here. So the answer options are: call the doctor, apply 4 liters nasal cannula, raise head of bed, or have the patient cough and breathe deeply. So first we are going to, so we already decided the topic, which is the shortness of breath. So step 2 is, are these assessment or implementation? So call the doctor. Is that assessment or implementation? I would say that is implementation, because you're not assessing anything. So we'll put an I right there. Apply 4 liters of nasal cannula. That's implementation. Raise the head of the bed. That's also implementation, because you're doing something. You're not assessing. Have the patient cough and deep breathly. Again, that's implementation, because you're not assessing anything. So after that, we're going to apply Maslow's hierarchy of needs. So we're going to divide it to physical or psychosocial needs. So call the doctor. So that's not really attending to either of the needs, but we could say he might give us some orders, and that would be attending to most likely the physical needs. So we'll put P for physical. Okay. Apply 4 liters nasal cannula. Again, that's going to be physical. Raise head of the bed. That would be physical. Have the patient cough and deep breathe. That's, again, physical. Something psychosocial would be like if there is an option to comfort the patient, or maybe get one of their religious leaders in there to comfort them. That stuff is like the psychosocial. So now, are any of these related to our ABCs? Airway, breathing, and circulation. So call the doctor. No, that's none of the ABCs. Apply 4 liters of nasal cannula. So that would be breathing. So we put B for breathing. Let's see. Raise head of the bed. That is airway. Apply. Have patient cough and deep breathe. That is breathing. Yes, B is right here. That apply 4 liters of nasal cannula. That is breathing as well, so I put a B there. Raise head of bed. Yes, airway. And again, call the doctors. None of those. So now let's go with what is the outcome of each of the remaining answers. So call the doctor. That's not really going to be fixing what the patient is needing right then and there. And the doctor is going to be asking for all the stats and everything. If you just walk in and see that the patient is short of breath and you don't have any other information, you call the doctor. The doctor's going to be wondering why you called them. Apply 4 liters of oxygen on nasal cannula. So this, it would, if their stats were dropping, it could bring it up a little bit, but depending on how low they are, 4 liters is a bit much to start somebody off on. If they're having a little bit of shortness of breath, and the oxygen may or may not even help. Okay, so raise head of the bed. This one is gonna be the correct answer here. So this is gonna help put them in the best position for breathing. It might help with the shortness of breath. And then have the patient cough and breathe deeply. This is good to do and all to help people get more air into their lungs and clear out anything bad that's in there. But it's ultimately not the best option for this, because as you see here, we have airway here, and it comes first in our ABCs, and there's breathing here, which comes second. So we're obviously going to go with the first one, airway. For the have the patient cough and breathe deeply, that would be my second answer. And if this was a select all that apply, I would most likely select C and D, but it is not. Raise the head of the bed is the best answer here. So if I could only do one thing and then leave, what would I do? I would raise the head of the bed. Okay, I'll scroll up and show you guys the Kaplan's decision tree again. So what is the topic? Are the answers assessment or implementation? Are they physical or psychosocial in meeting the patient's needs? Are they part of our ABCs, airway, breathing, and circulation? And what are the outcomes of the other answers? And always remember, what would you do if you could only do one thing? All right. Thank you for tuning in. I'll see you next time.